Hey, Mr. Welch, my name is Brittany. I'm going to be your nurse today.
Nice to meet you.
Now, what's going on?
I got a headache on the right side of my head.
So, can you describe that headache a little bit more for me, like what it feels like?
It's a little achy and sore.
A little achy and sore just on the right side?
Just on the right side.
So, on a scale of like 1 to 10, how would you describe the pain?
I'd say an 8.
About an 8, so that's pretty severe. When did it start?
About 6 o'clock this morning.
Okay. Have you noticed any other symptoms with this headache?
A little nausea and some light sensitivity.
So when you look at the light, it
Gives me a headache.
okay. Now you say you've been nauseous. Have you gotten sick on your stomach? Have you vomited?
Yeah, I vomited once this morning.
Just one time this morning.
Mm-hmm.
Have you ever had anything like this before? Is this something new?
About once a month.
Okay, so you're having it pretty frequently.
Mm-hmm.
Okay. Is there anything you've noticed that triggers this headache? Or anything makes it worse?
There are no aggravating factors.
Okay. Anything that helps? Have you tried anything over the counter?
Excedrin migraine and putting a cool towel on my head seems to help.
Okay, but pain's not going away completely with that?
No.
Okay.
Mm-mm.
Well, since you're having something going on with your head, I'm gonna kind of go over a little bit with your head, your ears, your eyes, your nose, and your throat, just to make sure there's nothing going on there. Later on, we'll do a full assessment on you, but just for today, we're gonna focus on that. So, have you noticed any skin changes, any rashes or itchiness around your face, eyes, neck, or throat?
Itchiness in my throat.
Itchiness in your throat, okay. Is that something new, maybe like an allergy or something?
Not really sure.
Okay. Any hair loss or any concerns with hair growth in areas where it shouldn't be or normally isn't?
Not that I know of.
Okay. Now, you said you have some light sensitivity. Have you had any blurred vision?
A little bit.
A little bit. Do you wear contacts or glasses?
Contacts.
Okay. Do you get your eyes checked regularly?
Once a year.
Good. That's what's recommended, so good. So you wear contacts. Now, the blurred vision, is that just with this headache or is that every day?
Sometimes with the headache, sometimes not.
Okay. Do you have dry, itchy eyes maybe?
Mm-hmm.
Could cause that. Okay. Just be sure you can get some over-the-counter re-wetting drops for your eyes, and you could try to see if that would help with that. Now let's talk about your nose a little bit. Have you had any drainage from your nose or
Yeah, a little runny nose.
Runny nose. What about any nosebleeds?
A little bit.
Okay. How often do those occur?
About once a month, once every few weeks.
Okay. Now, your this headache, you haven't had any head trauma, brain injuries, concussions, anything like that, have you?
Not that I know of.
Okay. Haven't hit your head or had any injuries there?
Don't believe so.
Okay. Now, your ears, have you had any drainage or any concerns with your ears?
No.
Any ringing in your ears?
No.
Okay. Have you ever had a hearing test?
Yeah, I've had a few.
Okay, yeah, I saw on your chart here that you work in construction, so you're probably around a lot of loud noises each day. So be sure you're wearing your hearing protection and eye protection with your job. Now, your mouth, do you go to the dentist regularly?
No.
Okay, you need to go at least every 6 months. That's recommended. So be sure to get in with your dentist, because oral health is really good and it's really important. So just be sure to follow up with them. Any concerns with any sores in your mouth or any bleeding gums or anything like that?
No bleeding gums.
Okay, good. All right. Now your throat, have you had any difficulty swallowing or any concerns there?
No, it's just always itchy and scratchy.
Okay. And maybe that's from it sounds like you may have some allergies going on there, but it's no trouble swallowing any foods, or you don't get choked or anything like that.
Mm-mm.
Okay, good. Well, it sounds almost like you have a migraine. over the counter remedies are really what can help with that. You've had no neck injuries or anything, have you? I know you said you haven't had any head injuries, but no injuries to your neck with your job or anything.
Not my neck.
Okay. Any dizziness, lightheadedness?
Yeah, sometimes.
Sometimes. When does that happen?
In the heat.
In the heat. Okay. Are you hydrating well?
When I get a chance.
Okay. Well, just be sure you're eating like you're supposed to, that your diet's good, and be sure that you're hydrating well, especially when you're out in the heat, to prevent dehydration or any passing out spells. We don't want that because that could come with some other injuries. So just be sure to do that. With the itchiness in your eyes, be sure that you're using some re-wetting drops, and try some over-the-counter remedies for that headache that's been going on. If you have any other concerns, just let us know. Like I said, next time we'll do a full assessment on you and make sure that your heart and your stomach and everything else looks okay. All right?
All right.
It was nice to meet you.
Nice to meet you too.
Have a good day.
Uh-huh.